Dear colleagues and dear chairs, dear organizers of this Congress Mini, thanks for the opportunity to present to you data on the real-life use of TLC NOSF polyabsorbent dressings in the treatment of patients with a diabetic foot ulcer. First, my conflicts of interest. In 2018, a double-blind RCT in the treatment of diffuse with TLC NOSF healing matrix, which is sucrose octasulfate, was published where it could be shown that those dressings were superior in wound healing compared to the contact layer. We have more data on the treatment of those patients. Overall, we have data on more than 10,000 patients concerning the treatment with those dressings in different etiologies like leg ulcers, pressure ulcers, but of course in DFUs too. So up to now it could be shown that those dressings seem to improve wound healing, increase the wound healing rate, reduce healing time, improve the quality of life of the patients treated, and are overall cost effective. The idea behind this trial, which I'm going to present to you right now, was to look at a real-life condition in the treatment of those patients in the terms of wound healing and health-related quality of life. It was a prospective, non-interventional, multi-center trial. A certain range of dressings could be used. All kind of chronic wounds of different etiologies were included in the trial. The first patient in was in the beginning of 2019. Last patient was included in the middle of 2020. Altogether, 217 patients with a DFU were included in 55 active centers. The patients were followed for a duration of a maximum of 3 months or 4 documented visits. All overall, most of the centers were general practitioners, and the next large group were internal medicine specialists. As I said, it were wounds of various etiologies which were included in this trial, altogether 961 patients. Shown in red here are only the patients with a diabetic foot ulcer, 217 of those 961 patients. And my report from now on will only focus on those 217 patients with a diabetic foot ulcer. When we take a look at patients' characteristics of this trial, there's nothing surprisingly here. We had about 60% male patients compared to 40% female patients. The mean age was about 70 years and the cohort was slightly obese. Of course, most of the patients had type 2 diabetes mellitus, whereas less than 5% had type 1 diabetes mellitus. What was a little surprising to me was that only about 50% of those patients had a confirmed peripheral neuropathy. Other comorbidities are listed in the lower table. Wound characteristics at the initial visit were that the median wound duration was 29 days, what also was surprising because it was planned to include chronic wounds, so wounds with a wound duration of more than a month. So, closer look here, 60% of the patients had a wound duration of less than a month, so non-chronic wounds, and only 40% had a chronic wound with a wound duration of more than 1 month. The median wound area was 3.1 square centimeters. At the initial visit, more than 50% of the wound bed tissue was either necrosis or fibrin, and less than 45% were granulation tissue. Looking at the wound healing outcomes of those patients, we can say that roughly 60% healed completely within the follow-up period of 3 months, shown in the dark green part of the column here. Altogether, more or nearly 90% of the patient showed at least a slight or great improvement or healed completely throughout the trial period of 3 months. When we take a closer look at the wide dose results between the non-chronic and the chronic ulcers, we see, of course, a difference here. In patients with non-chronic wounds with a duration of less than a month, we achieved more than 70% wound healing within 3 months of follow-up, whereas in patients with a chronic wound, we achieved altogether a very good 37% of complete wound healing in those chronic wounds. Altogether, nearly 90% of those patients with a chronic wound showed at least a slight improvement of wound healing. Health-related quality of life was recorded by the Wound QOL, a questionnaire specially designed for patients with chronic wounds. It reflects 3 dimensions: body, psyche, and everyday life, and it has been validated in several countries and languages and is very well accepted by the patients. Of those 217 patients with a diabetic foot ulcer, 69 patients completed the questionnaire at the initial and the final visit, so these could be analyzed. These were representative because there were no differences in comparison with the complete cohort of 217 DFU patients, except those 69 patients had a slightly longer wound duration at the initial visit. For each question in the Wound QOL questionnaire, there are 5 options which one can cross to answer the question, and the lower the score, the better the health-related quality of life. That means a score of 4 mean very bad or very impaired quality of life, whereas a score of 0 means no impairment in quality of life. We see here the results of this questionnaire at the initial visit compared to the final visit. At the initial visit, the global score was 2.2 in all patients, and at the final visit it was 0.9. So we saw an overall improvement of nearly 1.3 points in this questionnaire. And this improvement was consistent over all 3 dimensions of this score. And this was not only a statistical significant improvement, but it was also a clinical significant improvement, because the minimal important difference of this score is a difference of more than 0.5 points, which was overpassed in more than 65% of the patients. If you take a closer look and compare healed versus improved versus unchanged or deteriorated wounds, we see that patients with a healed ulcer showed the greatest improvement of quality of life, whereas patients with only an improvement of the wound showed less but still statistically significant and clinical significant improvement of their quality of life, compared to those patients with no change in wound healing or deterioration of their wound. They showed no change in the score. So the health-related quality of life was closely related to the improvement in the wound healing process. Altogether, those dressings were very well accepted, so no adverse events related to the dressings have been reported throughout the study in those DFU patients. At the final visit, the investigators were asked about their opinion of those TLC NOSF dressings, and they said that they found it either extremely useful or useful in more than 90% of the patients, very good or good handling in more than 95% of the cases. Patients reported that it was very well tolerated or well tolerated in more than 95% of the cases. It was associated with no pain or only a slightly short pain when changing the dressing in nearly 95% of the patients, and it was very well accepted, or at least well accepted, by more than 95% of the patients. In conclusion, one can say that this trial is consistent with the trials before, especially with the ones from the RCT. It comforts and completes the clinical evidence of those wound dressings. Those TLC NOSF dressings seem to be a simple and effective range of dressings to enhance wound closure in patients with diabetic foot ulcers. It seems that it significantly improves the quality of life, the health-related quality of life. It is very well tolerated and accepted by clinicians and patients. Thank you